Okay, hello everybody. Okay, so this is lecture number 2 of ethics in psychology. So a couple things I want to bring up as we move into the lecture here. First off, I had told you before that I will be having not only the readings that you have here, but there may be additional articles, and that will be the case this week. I will have an article that I want you to review. It's basically more of a philosophical article relating to the history of ethics in psychology. It's by an author who does an interesting job of comparing um, uh, the history of the ethics and sort of the philosophical groundings uh, of ethics for the American Psychological Association Code. An interesting part of the article is he also makes reference to the Canadian um, ethical guidelines. So it's really an interesting paper on the historical as well as philosophical aspects of the different ethics codes. That will be I want you to read that in addition to the material that you have in the book this week. And as it said, introduction, applicability, preamble, and the general principles is what we're going to be covered. I just opened up to the chapter on introduction and applicability, and I think that one is 7 pages, and the other sections aren't very much. So there will be additional articles because you don't really have a lot of reading assigned each week just from the book. I want to focus a lot this week on sort of the issue of the applicability of the ethical codes and sort of where does it come from. One thing you will see in the article that I provide is professional psychology was around for about 70 years without there being a formal ethical code in place. Now, it wasn't that that psychologists weren't showing the need for an ethical code. It wasn't that anybody disagreed that having ethics was not important. Of course, that was not the case. It was just that there were 2 reasons for it. One was as a professional entity, it was not thought that psychologists were in need of someone formally telling them what to do. It is interesting to keep in mind that medicine as a profession was around for many, many years, many more years than psychology or psychotherapy, without there having to be a formal ethical code of conduct in place, other than some very broad outlines. And was sort of for the same reason. The expectation was that if you're a professional and you are worthy of being in the profession, you will find a way to conduct yourself in an ethical manner. It was sort of giving deference to the individual for being responsible enough to practice in a way that would not harm their patients and the people who are looking to them for help. So for a long time in the practice of psychology, it was sort of thought that the professionals could sort of police themselves, that there was an understanding that if you're a professional, you could be expected to act in an ethical manner. And that in psychology, it wasn't even that there was like this rash of psychologists acting unprofessionally. It was just clear that there were so many cases where the decision about what to do in order to act ethically became uh, un, became somewhat arguable, meaning that exactly what you were supposed to do to act ethically, the argument could be made on either side, or there were situations where psychologists were finding themselves at sort of like no win. Whatever I do, I'm probably going to do something that's going to upset someone, and it was kind of hard to distinguish exactly what to do when it was possible you could hurt somebody regardless of which decision you made. So it was almost like the ethical rules were developed not only to protect the general public, or not just to protect the general public, but also to protect psychologists who were finding themselves in more and more situations where having to decide on their own what was the most ethical course was difficult, because there was always something where you were going to end up hurting someone. And psychologists find themselves in that situation again. One example that continues to come up is when psychologists are called into forensic legal settings, and particularly one that the ethical guidelines still get challenged many times are in custody hearings, where psychologists are often called in to give their opinion about where children should live, whether they should live, half with one parent, half with the other, always with one parent, always with the other, or some sort of mix. And psychologists are often called in to help make that decision. And it can be a real challenge, in part because the research on um, on what the best situation it is tenuous at best. It's not clear cut always what the best solution should be. So when psychologists are giving opinions and are asked to give opinions, sometimes they're relying on decisions where the opinion they're expressing is not one that is solidly supported with the research. There may be research on the other end, and psychologists are often having to sort of juggle that explanation of why they are giving one opinion when an argument could be made for the other side. So, uh, so ethical guidelines came about both as a way of protecting the general public from unscrupulous behavior on the part of some psychologists, and certainly that did happen. But it was also to protect psychologists who could say, well, look, I chose this path because my professional guidelines support me taking this path. So ethical guidelines come into play, and even now, and as you saw in the readings, it would not be correct to say that the ethical guidelines are solid and concrete. They are not meant to address every dilemma specifically. They are meant to give um, guidance on how psychologists should address professional situations. They're meant as guides, not as hard and fast rules. Now, it does not mean that because they are guides as opposed to hard and fast rules, does not mean that psychologists can ignore them. And it is absolutely the case that the opposite is true. Psychologists are supposed to show that they are following them in every professional decision they make. But what is true, what is the case, is that it is not always absolutely certain how the rules should be applied in every situation. So they are guidelines that are very strong and meant to be followed by psychologists, but they are not rules where every situation is clearly defined. and every possible outcome is clear cut. And that was on purpose, because psychologists are in a field where it is hard to come up with hard and fast rules that are going to apply equally well to every possible situation. There is a large variety of situations that psychologists face, and the guidelines were meant to give direction, but not to say in every situation the outcome will be the same, or the rule will be the same. I brought up, for instance, last week, my example of how this idea of dual relationships, which is a very important ethical principle, might be applied differently in the place where I have my outpatient office, because it is more of a rural community, and not really rural. It's in between urban and rural. It's not busy. It's not like a major city, like Pittsburgh, as I said, but it's also, it's not farmland, but there's farmland around it. So the general point I was making is that it's smaller. It's a smaller area, and so people know each other, and so the likelihood that I could stay away completely from seeing people as patients who I see and know in other settings would doing that would be very difficult. So I end up making different decisions about how to practice there and who to see, and maybe who I can't see, than I would if I were practicing in downtown Pittsburgh, which is, as I think I told all of you last week, I live in an area. It's kind of interesting. I live in an area. The place where my office is a half hour one direction, and that's the smaller community where my outpatient office is. And the place where I do some consulting I do consulting at a prison. I do consulting at some with some legal firms. Those are all downtown Pittsburgh. If my outpatient office was there, I would probably make different decisions about who I could see, because it would be more expected that I could stay out of knowing people that I see as patients in other settings. That's less likely to happen in the smaller community where I am at, or where my outpatient office is. And one thing I wanted to stress that I brought up last week that is essential for keeping in mind about this issue of applicability is that the most important issue, that if you ever get questioned on an ethical issue, is not necessarily what decision you made, it's whether you made a decision at all. And what I mean by that is, the first thing you will want to show if your ethics are ever questioned is that you had some evidence that you were thinking about that ethical issue. I have not, the biggest problem that psychologists have ever run into, from what I've heard, when their ethics have been called into question, has been when it looked like they either weren't aware of or ignored the ethical principle that was in place, that was relevant at the time. Where psychologists have had much less problems, from what I've seen and read, are when there's a situation where they say, here is the ethical issue that came into play, and here is why I made the decision that I made. And even if the people doing the questioning could argue that they could have made a different decision, maybe they would have thought a different decision was warranted, if the psychologist can show that they made a decision based on considering the ethical principles and didn't just ignore or forget about the ethical principles, they tend to be in a better place. as far as challenging ethical issues and ethical concerns. Okay, so that's an important thing. So being aware of the ethical principles as a psychologist is always going to be essential. One other thing I wanted to clarify that came up before is, what about psychologists who maybe have dual professions? They practice as, they maybe have a psychology license and practice in a different field. That's hard. I mean, that's difficult, but you have to, as a psychologist, show at least you are following your ethical guidelines. And even if you're also licensed in a different field. So that means that, for instance, if you are one that I could think of that comes up a lot, I brought up last week how there are several states where psychologists can prescribe medication. I think we said there were 5 of them. I have also known other settings in other states where psychologists have gone on to get nursing licenses, because in almost every state there is a way that nurses can prescribe medication. So if you're a psychologist, but you also get licensed as being a psychiatric nurse, then you can prescribe medication under your psychiatric nurse license, even if you are also licensed as a psychologist. I bring that up because over the past 20 years, probably no issue has come up as much for psychologists. No issue has come up as much for psychologists as psychiatric medications. And so, and that's in large part, maybe even 30 years, and that's in large part because over the past decades, the amount of focus on psychiatric medications has just skyrocketed. So there's been more and more interest in being able to prescribe medications. And so when a psychologist is licensed both as a psychiatric nurse and as a psychologist, that can be fine, but the psychologist has to make clear to the patient that when they are prescribing medication, that they are functioning in their role as a psychiatric nurse and not in their role as a psychologist. And that's, that's relatively clear cut. You can say, okay, as a psychologist, I can function as your therapist, and as your psychiatric nurse, I can prescribe your medication. Just making it clear that you are serving 2 different roles there. And that you are not prescribing medication as a psychologist, you're prescribing medication as a psychiatric nurse. Not difficult, but certainly important, because it has to be absolutely clear about what your professional role is with an individual, and if you are serving more than one professional role with an individual. It's interesting to keep in mind that this issue of medication, like I said, it comes up a lot in the ethical codes, and it's an interesting thing. As psychologists, our primary clinical focus is psychotherapy, and psychotherapy is a very, very important treatment modality. It is not the easiest treatment modality, is not the quickest treatment modality, and people often come in wanting the quicker treatment. They want quicker treatment. They want easier treatment, and that's not psychotherapy. Also, people will want to come in will come in wanting to believe strongly that their problems have something to do with them medically. So they will, rather than believe that they're just not handling situations well, that there might be something emotionally blocking them from making progress in their lives, that they may need to sit back and think about what the meaning is of their life and how they're going to find that meaning, that there may be issues with how they're interpreting situations, and they may need to take a good hard look at how they've gone about interpreting situations in their life and how they might do it differently. Rather than think of that, people would rather believe that there's just something wrong with their biochemistry. You know, give them a medication or do this medical intervention and everything will be fine. You won't be depressed anymore. You won't be nervous anymore, all that sort of stuff. We as psychologists know it's much more complicated than that. But simply from a marketing perspective, people will come in wanting the easier explanation, the quicker explanation, and we often can't provide that. So what that means is psychologists have to be on guard from getting sort of sucked into this idea that, well, maybe I can do something in that realm. Maybe I can give this person what they want. And if they're looking for medication or looking for a relatively quick or easy medical explanation, maybe I can give that to them. And we often can't. And so the ethical guidelines keep us away from being able to provide that, or to say to people that we can provide that. That we can say, okay, well, if you're feeling anxious and you're on 0.5 milligram of Xanax, just try taking a full milligram and see if that works. That's not the sort of recommendation we can give. We can't give guidance on medication. And I think in that case, it'd probably be good for me to give you an example, like where would because we can't prescribe the medication in the first place. So why would that even come in? So probably the clearest explanation of the sort of ethical dilemma that a psychologist can run into with psychiatric interventions is you have a patient who comes in to see you who says, well, I could go see my physician. I could get an appointment with my primary care physician tomorrow, but I can't see a psychiatrist for another 3 months because they're backed up. And so a psychologist might be tempted to say to a patient, well, look, I know you're depressed. I've done my clinical evaluation of you and I know that you're depressed. So you should ask, when you go in tomorrow, tell your physician that you would like to be prescribed Zoloft. 25 milligrams, 25 mil. I've had a number of patients. I've done the reading about this. Tell your physician you would like to be prescribed 25 milligrams of Zoloft. Patient goes in to make an appointment with their primary care physician. Primary care physician says, I went and saw my therapist who said I should be on 25 milligrams of Zoloft. Or I went and saw my psychologist who said I should be on 25 milligrams of Zoloft. It's not necessarily the case that the primary care physician would know that you're not supposed to be making recommendations about medication. For all you know, the patient said psychologist and the primary care physician heard psychiatrist. It may even be that your patient mistakenly said psychiatrist other than psychologist. That happens with me all the time. Someone will say, even say to me, well, I know you're my psychiatrist, but who is my psychologist? And I have to say, no, I'm your psychologist. Your psychiatrist is Dr. So-and-so. People, the names are similar. People get confused. Primary care physicians don't hear everything their patients say. And primary care physicians wouldn't really necessarily know that a psychologist isn't someone who can prescribe medication. All those are possibilities. But in that way, a psychologist would have acted in an unethical manner because the psychologist would have been given guidance on medication that the psychologist has no formal training or sufficient formal training to address. So that's an example of how it can sort of go on down the line, that psychologists can get in trouble for giving suggestions, giving formal recommendations for something they are not deemed to be professionally uh, professionally trained enough to do. Okay. Now, in my practice, I don't make recommendations or medications. I will, this is an example of an ethical decision. I will at times tell someone if I don't think they need to be on medication, but I think that they should give therapy a try first, before going on medication. A lot of times I'll get new patients will say, do you think I should be seeing a psychiatrist? In that case, I do feel that I'm professionally able to tell a patient that no, I think therapy has a good chance of working, before you get on any sort of medications, before you try medications. In that case, I think that I'm well within the ethical guidelines to say that, because I am not making a decision about medication, I'm making a decision about psychotherapy, which I am trained for. However, I will tell you that I usually will follow it up by saying, but you need to make your own decision. And if you are so depressed that you can't get out of bed, or you can't take care of your kids, or you can't go to work or anything like that, then I'm not saying you need to be on medication, but you should talk to your physician or should talk to a psychiatrist about that possibility. I'm not recommending you need to be on medication, but if it gets so bad you just can't function, then you should go talk to your physician or go see a psychiatrist. But again, that's a stipulation I add just to take care of the possibility that things could get worse for this individual. And if they get worse, then they probably should be seeing a medical professional. One thing they say here in the book that I wanted to get to, interpretation of standards must be guided by unique circumstances and specific modifiers. And one thing, so basically what that's saying is, each situation is unique, and you need to decide how the ethical standards apply based on the situation. And there are words. One thing I think is useful to keep in mind here, that throughout the ethical code, words like reasonably, appropriate, potentially are used throughout. So to say a situation is potentially a problem, or psychologists need to be reasonably sure they are basing their decisions on solid research. Those words are useful as a way of underscoring as underscoring the fact that the ethical codes don't apply to every situation in the exact same way. Okay. Now what's interesting here is there's something else that they bring up here that I think, and I'm looking at the end of the one of the first chapter. The APA ethics code is not a legal document. And that's really interesting to keep in mind. One thing I should stress here that I didn't stress in the first week, and I realized that after the class, was that this course I realize is called Ethics and Law, meaning that we will be looking at the ethical code, but we also will be looking at some relevant laws that apply to psychologists and legal issues that relate to the practice of psychology. And that's important. And one of the reasons that's important is to keep in mind that the Code of Ethics is not a legal document. So here's what you have here. We are reading here a book called the book that we have for this course is the Ethics Desk Reference for Psychologists. And I like this book because it is a little bit more readable than the APA ethics code. But there is an APA ethics code. This is basically a summation of the APA ethics code, which is a different book. The APA ethics code, like it says here, is not a legal document. They are not laws. Every state has their own set of laws related to the practice of psychology. One of the things that will periodically come up here is I will have to point out that some of the laws that are relevant where I practice are not the same as the laws where you will practice. I'm in Pennsylvania, and most of you will be working to practice in California. Not all of you, I realize, but most of the students I've had in these courses have been looking to get to practice in psychology. My state has different laws for psychologists than California does, and there are some differences. But most states basically set the laws that they make that are different in the ethical code mostly have to do with how the term psychologist is defined, what sort of licensing process there is, how you maintain your license, and how you keep your license. Much of the rest of what states will do to set the laws for psychologists is to simply refer to the APA ethics code. So even though the APA ethics code is not a set of laws in and of itself, it is often in almost every state. In fact, I would say every state, it is used as the basis of the laws that they set. So rather than legislatures who, the individual legislatures would probably have just different understandings of what what a psychologist is and what they do, rather than them having to get into the minutia of all the things that they're saying a psychologist needs to do to practice in an ethical and legal manner. They will often, as the base, just say that they will follow the same rules set in the APA ethics code. Now, there are differences, and we'll talk about different laws. Some areas of the laws where psychologists differ in different states are things like admission to a psychiatric facility. In my state, in Pennsylvania, I cannot directly admit somebody involuntarily to a psychiatric facility. In California, licensed psychologists can involuntarily commit someone who um, who is deemed a danger to themselves or to others. In my state, in order to do that, I have to call a crisis management team, or I have to, um, if the person is taken to a hospital, I have to talk to the emergency room physician and give my I have to talk to either the crisis management team or an emergency room physician to give my view of why I think the person needs to be involuntarily committed. I cannot commit them myself, but in some other states, psychologists can do that. In my state, only psychiatrists can do that. The difference between the laws are some states see the commitment of somebody on an involuntary basis as having to be a medical decision. And since I am not a medical doctor, I do not fit that category. But there are other states where psychologists can involuntarily commit someone directly to a hospital if they are deemed to be a danger to themselves or to others. Another and so but again, that's the same sort of thing. That's a difference in the definition of what basically the laws between states often differ or do differ in terms of what a psychologist is, like so how do you get a license to be a psychologist? And also what a psychologist can do. But how the psychologist should practice in almost every state is basically summed up in the ethics code. So even though the ethics code is not a set of laws, it is used as the basis in the laws for how a psychologist should practice. And then the differing laws between the states are how is being a psychologist defined and what exactly can a psychologist do. So that's sort of how the ethics codes, how you will see it used in the different states. It is not a legal code, but it is often used as the basis for the legal codes in different states. Okay, so here's the ethics code. 70 years the profession went without it. And then the decision was made to start to formulate one, like I said, as a way to not only protect the general public, but also to protect psychologists so they could field so that they could feel they had some sort of guidance on what the right thing to do is when they're working in complicated situations where figuring out what the right thing to do might be complex. So it was meant not only to help the general public, but also to help psychologists. It is not meant to be hard and fast rules for every possible situation that could come up. It's more meant to provide guidance and a framework for making decisions about what to do when situations are potentially problematic. As said, it is not a set of laws, but it often serves as the basis in different states for the laws that those states set about how psychologists are supposed to practice. And then there are different laws that differ between the states, and those laws, the ones that differ between states that aren't based on the ethical code, mostly relate to how you define a psychologist, how you define what a psychologist is, and what psychologists are allowed to do. And again, that second thing, what psychologists are allowed to do, the clearest example is the states where psychologists are allowed to practice, I mean, are allowed to prescribe medication. So in the state of Louisiana and the state of New Mexico, psychologists who meet certain additional training requirements are allowed to prescribe medication for their patients. In the state of Pennsylvania and the state of California, the two main states that we'll be concerned about in this course, the psychologists cannot prescribe medication. And if they want their patients to receive medications, they have to refer their patients to some sort of medical professional, you know, licensed, well, a licensed psychiatrist, a licensed nurse practitioner, those sorts of professionals. Okay. So what can happen if you break the ethics code? Well, it depends. As far as the ethics code, breaking the ethics code, there are a number of things that that can happen if you violate the ethics code. The American Psychological Association can take actions against psychologists who break the code. And if you're not a member of the American Psychological Association, if you break the ethical code, the American Psychological Association could take steps against you. But if you're not a member of the American Psychological Association, that wouldn't carry much weight. If you look in the guidelines here, what tends to happen is that the American Psychological Association can do an investigation of you and share that information with the state where you're licensed. So even though the American Psychological Association is the one who sets the ethical guidelines, and the American Psychological Association does not really have that much power. If you're a member of the APA, they can kick you out. But if you're not a member of the APA, it doesn't matter if they kick you out. You're not a member anyway. But what the American Psychological Association can do and will do is share their investigation, share their concerns with the state licensing board. And the state licensing board can do a lot to you. First off, they can suspend, revoke, or take away your license. That's a huge problem. And if it's much worse than that, if there also can be criminal penalties or civil penalties labeled against you if you violate the ethical code. Now, very often that I bring up first about the American Psychological Association because we're talking about the ethical code. So that's from sort of top down. The American Psychological Association finds out about a breach of the ethical code because someone reports them, and then that's shared with the state, and the state can take legal civil action against you. Penalties can include things like taking away your license, revoking or suspending your license, and then criminal charges can be filed if it meets that criteria. Most of the time, the situation is reversed. It's basically bottom up, meaning the state finds out about a problem, they take action against you, and then they share it with the national organization, and the APA can then take action. Now, like I said, if you're not a member of the APA, it's not going to be relevant. But one of the reasons that can be a big problem is because a state licensing board is only in that one state. The American Psychological Association is national, so they can make it known to other states when there's been an ethical concern that the APA has about an individual. And so, you lose a license in one state, you try moving to another state, the APA can make life very difficult for you, even if you're not a member of the APA, because they've been made aware of your ethical violation. So, but usually the state will be where it starts. If someone has a concern about an ethical issue, they will file that complaint with the state licensing board. And then the state licensing board will investigate it. And if they find that the individual did violate the ethical guidelines, they'll take action, and then that action will be shared possibly with the State Psychological Association and with the National Psychological Association. So some of the penalties that can result because of this connection between state laws and the ethics code. The ethics code is not laws, but state often uses the ethics code to set their laws. Violating an ethical code can get you into legal trouble because of that. Now, like I said, what the state will do if you violate the ethics code varies depending on the severity. But if you break the ethical code in every state, it also means that you broke their law, because that's how the law is based. You could get your license taken away. You could get your license suspended. Those are two main things that happen with the license. And then you could face criminal or legal charges depending on the severity of what happened. It's probably useful here for me to point out to you something. The American Psychological Association, who set the ethical code, it's an interesting thing that the American Psychological Association that sets the ethical code that does a whole lot of advocacy on parts defining what psychologists can do and how they should be trained and all that. The American Psychological Association, who certifies graduate school programs in different types of psychology, certifies internship sites, and the American Psychological Association, whose certification is so important that many places, like, for instance, the Veterans Affairs Department nationally, will, for the most part, not take on a psychologist unless that psychologist has been to an APA accredited program, an APA accredited internship. The American Psychological Association, who does all those things, is not a particularly powerful organization when you compare it to things like the American Medical Association. Most psychologists do not belong to the American Psychological Association for a variety of different reasons. It is and certainly a vast majority of psychologists who primarily practice clinical psychology do not belong to the American Psychological Association. This differs from the American Medical Association, to which most medical doctors belong. There have been a number of reasons for this. Many psychologists have had bad opinions about different political positions the American Psychological Association has taken. One decision that came up several years ago, actually 10 or 20 years ago, during had to do with the use of torture in the military, because it turned out that a lot of the approaches to torture that the military was using were developed by psychologists, and many of those psychologists were members of the American Psychological Association. And a lot of people in the American Psychological Association had sort of a movement to try to get the American Psychological Association to just say across the board, psychologists could not be involved in anything resembling torture, and any psychologist found to do that has to be kicked out. The American Psychological Association was not as strong in their condemnation of that as many members would have liked. So a lot of members left because of that. That's just one example. But as a membership organization, the American Psychological Association is not that strong. So it really doesn't have direct sway over a lot of psychologists because they're not members anyway. So really it comes from the its strength in this comes as recognition of a professional organization that sort of sets the standards. And so when people are looking for standards to set for psychologists, they turn to the American Psychological Association, even though the American Psychological Association does not have much direct effect on the majority of psychologists. Okay, that sounds like a good place to stop for now. Remember to look for that article. I'll post that shortly. And I will see everybody at the next class. Have a good week, everyone.